Okay, this is our straight leg raise test, a classic and simple orthopedic test for low back pain to see if there's maybe some disc involvement, potentially a disc bulge. Now, no orthopedic test is ever a confirmation of any sort of certain pathology, but it starts to tell a clinical picture. If you're having leg pain that is again radiating down the back of the leg or side of the leg, then there's potential of maybe some disc involvement. This is a test that can tell us a little bit more. If you're having pain on one side, first raise the well leg or the side that's not bothering you. What you're doing here is you have a friend either passively bring this leg into flexion, or you can actively bring this leg again into as much flexion as you comfortably can. Trying to let everything else be loose and relaxed. What we want to see, or we might see here is pain that is starting to go down that affected leg. If you get nerve or shooting pain down that leg with this test, then it's probably a good idea to go get checked out by a professional. There's some disc involvement, some rehab is definitely warranted, and not that surgery is a must, but it's something that needs to be just looked at, right? It's on the table. We would always go for conservative care first. Now, if the well leg raise doesn't reproduce any pain or symptoms, that's great. Let's try our affected leg. Same thing, bringing this into straight leg, so straight knee flexion. See how far you can get. And if you start to reintroduce some of those symptoms down that leg as we do that, makes it worse, then again, same thing as with this side. We want to get that checked out. If we have just local pain that's recreated with this, so we get that low back pain coming back, but there's no radiating or shooting pain, again, there could be some disc involvement, could just be some muscle strain or facet irritation as well. So all these things are still on the table. And again, it just tells us a little bit more for the clinical picture. So here's the first test to do if you have low back pain to see what we get from that.